Narcissistic abuse is a form of emotional trauma that remains largely invisible, yet profoundly damaging. It involves a consistent pattern of manipulation, control, and psychological harm inflicted by someone with narcissistic traits. Dr. Durvasula, a clinical psychologist, describes it as behaviors aimed at control and exploitation. These behaviors include gaslighting, intermittent reinforcement, triangulation, silent treatment, and emotional withholding. Victims often struggle to identify or articulate their experiences, as the abuse is covert and the abuser may appear charming to others. This hidden nature makes it difficult for victims to have their suffering recognized and validated. Narcissistic abuse often follows a cyclical pattern, as explained by Dr. Craig Malkin. It begins with idealization, where the victim is placed on a pedestal, followed by devaluation, where they are systematically torn down. Finally, the victim is discarded, emotionally abandoned, only for the cycle to potentially begin again. This cycle creates a confusing and destabilizing environment for the victim, making it challenging to break free. The abuser's charm and manipulation often mask the abuse, leaving victims isolated and questioning their own reality, further entrenching them in the cycle. The impact of narcissistic abuse extends beyond emotional pain, affecting the brain and nervous system. Dr. Bessel van der Kolk explains that psychological trauma becomes embodied, creating lasting neurobiological changes. Victims often experience hypervigilance, with an overactive amygdala and decreased activity in the prefrontal cortex. This state of constant alertness leads to difficulties in decision-making and relaxation. Research has shown that prolonged psychological abuse can alter the hippocampus, affecting memory formation. Emotional pain from rejection and humiliation activates the same brain regions as physical pain, highlighting the profound impact of psychological abuse. The psychological impact of narcissistic abuse is profound and long-lasting. Dr. Christine Hammond identifies narcissistic victim syndrome, which includes chronic self-doubt, diminished self-trust, persistent feelings of shame, and difficulty setting boundaries. Victims often experience hypervigilance to criticism, emotional numbness, and persistent anxiety or depression. The most significant impact is identity erosion, where victims lose their sense of self, prioritizing the narcissist's reality over their own perceptions. This erosion of identity leaves victims struggling to reconnect with their authentic selves, even after the relationship has ended, as they grapple with the internalized voice of self-judgment. Narcissistic partners often isolate their victims, cutting them off from support networks and alternative perspectives. Dr. Sandra Brown highlights how this isolation increases dependence on the abuser and removes potential reality checks. Even after leaving the relationship, survivors struggle with trust and connection, fearing manipulation or control in new relationships. The bystander effect compounds this, as friends and family may minimize the victim's experiences, influenced by the abuser's charm. Dr. Shannon Thomas describes this as the wall of denial, invalidating the victim's reality and compounding their trauma. Despite the profound impact of narcissistic abuse, recovery is possible. Dr. Judith Herman outlines 3 stages of healing: establishing safety, remembrance and mourning, and reconnection with ordinary life. For survivors, establishing safety often begins with no contact or limited contact when complete separation isn't possible. Processing the experience involves making sense of what happened and grieving the damaged sense of self. Therapies like person-centered psychotherapy, trauma-informed therapy, CBT and somatic experiencing show promise in recovery. Person-centered therapy helps to re-establish congruence, emotional regulation, and rebuild internal stability. Recovery focuses on reconnecting with one's authentic self and rebuilding the capacity for joy and meaning.